We wanted to dedicate 30 minutes to something that is so important, something that we've been talking about for a couple of weeks, and we will continue to talk about every week until we get everybody on the other side of this into the new year and beyond, really. We want to talk about Medicare, Medicare Advantage specifically. So I'm going to go over a few things. I have a bit of a whiteboard here that I think we can kind of zoom in on as well. And then when I'm done with this, in about a couple of minutes, we're going to be bringing on an expert from the state, Medicare product manager, who's going to be able to answer as many questions as we can get to. So please email us at allday@fox.com if you have questions or need clarifications on something that we're covering. We already have a bunch, and we're just looking for more. If you can bring them, get them to us, we'll bring them to her. Okay, so just wanted to go over a couple of basic concepts here, so we have a foundation to go off of, and then we'll post this online. And I want to start with, very simply, the difference between Medicare and Medicare Advantage, which is at the center of what we need to talk about. So original Medicare, if you want to, there you go, thank you. Original Medicare, I've broken it down into these two parts. So this is health insurance for people who are 65 and older, and also people under the age of 65 with disabilities. This is that government-funded health insurance. There are the two parts you see, right? There's A and there's B, and these are both part of original Medicare, just plain old Medicare. Okay, so Part A, if you work 10 years full-time, you qualify for premium-free, no premiums, Part A. Part A covers things like hospital care, inpatient care, hospice should you need that. That's what Part A covers. Some of the other things with Part A, you can see any doctor or hospital. You don't have to worry about in-network, out-of-network. It is a pay-as-you-go system, so there's that, but also there's no spending limits, so it can be harder to kind of keep track of because there are no spending limits. It does have deductibles and co-pays, but again, no premiums on Part A. Part B, if we go to Part B, this is different in a couple of different ways. So Part B is you do pay a monthly premium. This is the one that covers things like doctor services and medical supplies, so kind of the medical coverage here, and also has deductibles and co-pays, just like Part A. So these are the different parts. You might have A, you might have B, you might have both. The one thing I want to point out before we move on from original Medicare that is going to be really, really important and we cannot emphasize enough. Original Medicare does not cover your prescription drugs, which is Part D. So we've got Part A and B, part of original Medicare. Part D is, think of drugs, D for drugs. Part D is prescription drugs, and neither of these will cover your prescription drugs, okay? Really, really important to remember. Now, there's some details that we're going to get into in a second to help bring some of this together. Why do we need to know the difference between original Medicare and Medicare Advantage? All right, let's take you down now. Medicare Advantage, and sorry, there's a little bit of a glare there. Medicare Advantage is called Part C as well. It includes Parts A and B, also includes Part D, that's your prescription drugs. So if you have Medicare Advantage, you've got A and B. You've also got your prescription drugs covered. This is sold privately. So Medicare Advantage is a plan that you'd have to get privately. And some of the things with Medicare Advantage, you do have to use doctors and hospitals that are in network, unless it's an emergency, like an urgent care emergency room. There are annual limits on the out-of-pocket costs, so that unlike A and B up there, this can help you kind of keep track of things a little bit because they have limits. Also does have the premiums, deductibles, and co-pays, okay? So that's the basics. That is what original Medicare is and Medicare Advantage. So now we kind of have a groundwork to go from. Okay. We're getting to the expert in a second, I promise, but I think this will save us a lot of time, and maybe your questions will get answered if we do this. Changes are coming, and this is why we're telling you about this. Big, big changes are coming as of January 1st of 2026 for Medicare Advantage plans, okay? So a lot of these are going to change depending upon who you have as a provider. We want to talk about medigap policies, some of the things you can do to to help make sure that you have everything you need going into the new year. Part D prescription drug coverage, this is a big one. Remember, I said this is a big one. We want to make sure that you have coverage for prescription drugs if you need it. And then I want to emphasize that no matter what happens, I just want to make everybody aware, rest assured, no matter what happens with all of these changes, you will have Medicare. You will have original Medicare. After the first of the year, you will have that. You're not going to be left without any insurance. You will have Medicare, original Medicare, as the first of the year rolls around, no matter what. Now, there's all kinds of, about 100 different roads we can go down now based on your specific experiences, and we'll get to some of that here in a second. I do want to bring in our expert here because I think I want to get to some questions, and she can help me round out the rest of this. Kelly Jo Greiner is joining us via Zoom, and she is, well, she knows everything about all of this because we spent a good deal of time on the phone the other day, and you really kind of know all of the ins and outs of this, the Medicare product manager. And if folks have ever used that senior linkage line, which is now the Minnesota Aging Pathways, toll-free number, call, get some advice. That's you. That's what you do. And so you've heard it all. Thank you for being with us and for taking questions today.
Well, thank you for having me. I am very excited to be here today, and hopefully we can help people get the information they need to make good decisions for 2026, because there's a lot of things happening right now.
So much. We will, if you're not here with us live, we will post this online and clip it, and you can share it with people who may need to hear this. But there's so many different ways, like I said, that we can go here, Kelly Jo, and I know we do have some viewer questions. I did want to just point out with you so that you can help me make sure that I'm doing this accurately. I did go through all of this with you to make sure. This part, though, we want to talk specifically about the people who need to hear this the most. Your advice was anybody who has Medicare Advantage should just kind of look into it, right? But specifically, we need to talk about certain providers here, and if your coverage is with them, you really need to pay attention, right?
Definitely, yes.
All right.
Because the plans are changing, and they're changing greatly. And one of the biggest problems every year is Kaiser Healthcare Policy Department does a survey on people that made changes to their Medicare Advantage or Medicare Part D plans. And every year it is the smallest number you can imagine. So most people with Medicare do not look at their options during open enrollment, and then they start the new year with a plan that in many situations is not best for them. They may not be able to afford it. It may not cover their drugs. It may not cover the providers they want to go to. And so these are big issues we're talking about here. And if there's one message we can get out to people is this is not the year to ignore Medicare open enrollment. It is not the year to do that. Yeah.
Check that ANOC, the annual notice of change that comes in the mail from your provider. Don't put it aside. Don't throw it in the trash. Open the mail from your provider, I think also is what we want to make sure people do. Really quickly, I'll go through and then we'll head back to these, but I wanted people to know UCare. So I don't know how far down we can scroll here. Sorry, guys. UCare, this is the big one. If you have Medicare Advantage with UCare, you need to pay attention because you will lose your Medicare Advantage when the first of the year rolls around. You will. Everybody with UCare. They are pulling out of Minnesota when it comes to their Medicare Advantage plans. Know that. That's a huge one. 160,000 Minnesotans, give or take. Also, this is different now, but United Healthcare, Humana, Health Partners, and sorry, this is Aetna down here. Pay attention. It's not a guarantee that you're going to lose it, but they are pulling out of some counties. So you need to know if you are in a county where they are pulling their Medicare Advantage plans. All right, let's bring Kelly Jo back in, and let's start taking some questions because I want to make the most of our time here. And I know we've got some up on the screen here. So here's one for you, Kelly Jo. I'm turning 65 early next year. We'll continue to have employer health insurance. Not planning on retiring next year, but not sure about when I might decide. So is there anything I should be doing now to prepare for the current or future changes in Medicare to prepare for the future?
This is a great question. And there's a couple of things. First of all, if you're contributing to a health savings account, you don't want to enroll in Medicare Part A right now. Most people, when they turn 65, will take Medicare Part A because it's premium free. But if you're contributing to a health savings account, don't enroll in Part A. Then regarding Medicare Part B, you do not need to enroll in Medicare Part B until your employer group health insurance ends and you decide to retire. And you have an 8-month time period to enroll in Medicare and purchase the options to fill in the gaps. It may be a medigap policy, it may be going into Medicare Advantage. You know, those basically are the primary changes that you're going to make. And one thing I do want to mention is if you do have retiree coverage through your employer, you are still going to want to enroll in Medicare Part B if you retire, and that is the coverage you have. The significance of that is Medicare Part B, you don't enroll in until you need it because you're paying a premium for something you don't need if you have employer drug coverage. You're also doing something called wasting your medigap open enrollment period. When somebody first enrolls in Medicare Part B, they have 6 months to purchase a medigap policy without any underwriting or health screening. If you don't purchase it during that time period, you can be health screened and the insurance company can deny and refuse to sell you a policy. So it's really important people understand that. So there's a couple of pieces to that, but as long as you have group health insurance coverage, you're satisfied with it, you're not retired, you're good to go.
Okay. All right. Do we have another question that we can pop up there? What is the difference between Medicare Advantage and medigap? This is a great question, right? We've talked about the difference between original Medicare, Medicare Advantage, but I know, Kelly Jo, you wanted to talk about medigap as well.
Yes, Medicare Advantage is that plan, also known as Part C, that combines original Medicare, Part A and B, and prescription drug coverage, Part D, all into one private plan that is sold by insurance companies. The positives about these options, or the pros of them, is they can be less expensive than a medigap policy. You must, however, use the providers that participate with the plan in order to get the maximum amount of coverage and payment. And if you are out of the network and have an emergency, your service will be covered. But if you're out of a network and need to see a provider and it's not an emergency, then you will have to pay out of pocket. The other thing about Medicare Advantage is they have a maximum out-of-pocket limit for Medicare Part A and B services, but that doesn't include the prescription drug benefit. The prescription drug benefit is separate. And that cap for 2026 is going to be $2,100. So thankfully that did change and we got rid of that donut hole.
Yeah, okay.
Then we have medigap, and medigap is also known as Medicare supplements. And these are meant to work together with original Medicare Part A and B. So people purchase a medigap policy to fill in the Medicare A and B gaps, the deductibles, and the coinsurance that are not covered by original Medicare. The one thing you want to remember is if you decide to go with a medigap policy, you pay the premium every month. There are no networks of providers. You can go to anybody that is taking Medicare patients, but you will not have prescription drug coverage unless you enroll in a separate prescription drug plan. We call them standalone prescription drug plans. So in that situation, you'll have original Medicare A, B, a medigap, and a Part D plan. With Medicare Advantage, you're going to have one plan to get everything.
Okay. So those of you, for instance, who have UCare and your Medicare Advantage is going away, this is something you need to pay close attention to because you may need supplemental coverage to get you through because you're going to fall back on this original Medicare and that may not be enough. So this is what we're talking about, this medigap. And to be able to get this, you need to go through a broker, is that right?
A broker or an agent to purchase a medigap policy.
Okay.
That is the best route to take. They know medigap policies. They know what would work for you and what would not work for you. And we really encourage people to go that route.
Okay.
And if you have questions about this regarding agents and brokers, you can certainly call the Minnesota Department of Commerce.
Okay.
They license insurance agents and brokers in Minnesota.
And we've been showing, of course, the line formerly known as a senior linkage and now known as Minnesota Aging Pathways. That's the number. You've said it's been very, very busy. People are understanding that there are big changes coming. I just want to say this a couple of different times during our 30 minutes together, but when should people call? Times of day that are better? When should people call that number to get the information they need to then go and make the changes with an agent or a broker?
That's a great question. We tend to be the least busy right away in the morning, and we open at 8 a.m. and we are open till 4:30. We also, because we are so busy, are really encouraging people to contact 1-800-Medicare. That is a call center that is run by Medicare. These folks are highly trained and they help people all over the nation look at plan options and enroll in plans. If you have a computer, we encourage you to go to www.medicare.gov and look at the plan finder where you can actually pull up options for you that will cover your drugs, you'll find out what the premiums are going to be and what the costs are going to be. And new this year, Medicare is adding the list of providers. So it basically is now becoming a one-stop shop that people can really go to medicare.gov. They can find the options best for them and they can actually enroll in a plan.
Okay, and just really quickly, we're gonna take a break, come back and do a bunch more questions. But if you go online, one thing you mentioned yesterday, we won't get into details, but you may need some help. There's a two-factor authentication that needs to happen. Get somebody to help you out with that. These are things that confuse me as well sometimes. So just know that if you're going to go online to do that, that is part of what you'll need to do to get that personalized experience. We're taking your questions today on Medicare Advantage. We're really glad that you're here. Kelly Jo Greiner is here. She's a Medicare product manager and has, I think, all the answers. So let's take some more questions from our viewers here. What do we got, guys? We've got, I think we definitely got a lot more to go here. Let's see. Sometimes. There we go. I live in Albert Lee. Why is the benefit coverage options for us worse than it is up in the cities? Why isn't the same coverage available to us at a higher premium?
That is a great question. And the reason for that is the Medicare reimbursement to the Medicare Advantage plan varies by county. So in rural counties, they tend to get less money. And so they may not participate in as many counties and they may have higher premiums.
And that is what's happening, just by the way, here in these counties that are affected with United Healthcare, Humana, Health Partners, and Aetna. These are the counties where they're losing money and pulling out of those specific counties. That's why it's sporadic with them. But UCare, everybody, all of the Medicare Advantage plans are being pulled. Again, United Healthcare, Humana, Health Partners, Aetna, specific counties. Okay, let's go to our next question. Father-in-law is losing his UCare Medicare Advantage plan in 2026. I'm unsure who even offers a plan in his area. He is in Lyon County.
I would encourage you to call 1-800-Medicare or to contact Minnesota Aging Pathways, because what you need to do, and if you have access to a computer, you can actually go into medicare.gov plan finder and you can look up what plans are available in Lyon County. I know Lyon County does have some Medicare Advantage plans that are available this next year.
Yep. I know Health Partners is not one of them. I looked that up. And going online and searching for which counties, I tried to do that yesterday, and it just, it's not easy to figure out. So really go through, as Kelly Jo said, those resources to get the crystal clear answer, not whatever AI generated answer you end up getting. This is too important. Okay, next question is, I'm currently on UCare Complete. What would be a good compatible plan for me to change to?
Another great question that I can't answer unless you go through the Medicare Plan Finder tool, because that will show the plans available to you depending on where you live, what the costs are, and what the coverage is. I can tell you, there are comparable plans out there, and it's important people know that. Even though UCare is leaving the marketplace, there still are options for people, and there's good options out there for people. And we don't want them to just ignore this and not take any action during open enrollment.
Yeah, you don't want to get into this and go to the doctor and then come home and get a bill for prescription drugs or for, a higher deductible or something. Just definitely take a look now. Let's go to another question here. UCare plans were popular because of the convenient credit card you could use to pay for dental, hearing, and vision care. This card was loaded with $1,600 in 2025, $2,000 in 2024. With the UCare plans no longer available, will any other Medicare Advantage plans have something similar?
Some of the plans will have something. I don't think it's going to be quite to this high of a level as UCare offered. That again was another one of the really popular aspects of the UCare plans.
Kelly Jo, you said people signed on to UCare and they stayed with UCare. This was really popular to stay on. And this is like the first time they're having to take a look at this.
We have found that UCare enrollees, for the most part, were very happy with their plans, and they stayed with them through all these years, and now they have to make a change. They're not happy about it, as you can, I'm sure, understand, and there's probably some of you that are on the call that are not happy with what is happening. But that adds to the importance of reviewing your options and making a good decision for 2026.
All right, next question. Let's take, do I need to enroll in Medicare if I'm a disabled vet and I'm currently using the vet hospital for my needs? Great question.
That is a great question. If you are satisfied with the vet services that you're receiving, you do not need to enroll in Medicare. But here's the important thing to keep in mind. If you need to go to another facility that is not the vet hospital, your veterans benefits in most situations are not going to pay for those services. So that is why many veterans enroll in Medicare. So they have that should they need to go to a Medicare-based provider.
All right. Thank you for that question. Thank you to everybody. Let's keep going and try to get through as many as we can. Someone told me you can use HSA funds tax-free to pay for Medicare Advantage premiums, but cannot use them as tax-free for medigap or Part D premiums. Is this correct?
That actually is correct, believe it or not. Yes.
Okay.
That is correct.
Easy answer. Okay, next is, do you know what's going on with MRRA?
I am not sure what MRRA is.
I was hoping you would know because I was like, what? Not sure what that is. Okay, so if that person...
Medicare, I'm not sure what that is.
Yeah, if that person can email us again and just let us know what that acronym is, that would be fantastic. I'm sure it's something really important. All right, here we go. Hello, I have a family plan through my employer. I pay for the best plan my employer offers. What would be the best options for my son that has a heart condition? I live in Farmington and then go to Mayo for his checkups.
And that is a big issue, people being able to go to Mayo Clinic. And I understand from what you're saying here, I don't want to assume anything, but is your son on Medicare, Social Security disability, and has Medicare as a result of his disability, and he wants to go to the Mayo Clinic? The Mayo Clinic does not participate with many Medicare Advantage plans at all. They take original Medicare and medigap policies. So you are going to want to look at medigap as an option. If you have employer coverage right now, and I'm sure your employer is paying for him, but should that change, that's when you're going to want to look at a medigap option for him so he can continue to go to the Mayo Clinic. I think there are maybe a couple Medicare Advantage plans that participate, but it's very, very few. Mayo sent out a letter this fall to their patients letting them know that they are not participating in most Medicare Advantage plans for 2026.
That is really, really important for people to know. Thank you for that question. Do we have any more on graphics? Here we go. Do I need to carry Part B if I have Freedom Blue Give Back Blue Cross Blue Shield plan? Blue Cross Blue Shield we haven't talked about here, Kelly Jo, so why don't we address those who have Blue Cross Blue Shield? What do they need to know, and specifically this question?
Yeah, there are definitely changes happening with Blue Cross Blue Shield as well. And I'm not sure what you mean by the give back. What I can tell you is to get Freedom Blue, you do need to have Medicare Part A and B. So I don't know if that helps answer your question, but I'm not sure what the give back is, because I'm not familiar with a give back Blue Cross Blue Shield plan. Maybe I'm missing something out there.
Okay, we'll look into that. And again, you're not seeing Blue Cross Blue Shield listed here as one that has indicated they're going to be pulling out of certain counties, but definitely if you have Blue Cross Blue Shield, you have Medicare Advantage, just check. Everybody should just be checking at this point. Okay, we're going to take one more for now, to be continued though. What happens for the elderly that are receiving county help for assisted living and nursing homes? Great question.
That is a great question, and I'm sure that that is tying into what the unknowns are about Medicaid or in our state medical assistance program. And we don't know at this point in time. We are all very hopeful that there will not be disruptions for people that are in assisted livings and nursing homes, but we don't know until all of the regulations regarding the changes to the Medicaid program are issued. The other thing that I want to mention for people that have Medicare and are in assisted living or a nursing home, Medicare has a very limited benefit, and it basically covers 20 days in full, and then from 21 to 100 days, those are copay days. So it's important people understand that you really can't think of Medicare being the benefit that's going to pay for your nursing home or assisted living. That's why the vast majority of people end up on medical assistance in Minnesota, because the costs are high and very few people can continue to pay those costs over long periods of time.
Okay, we are going to wrap up the questions here and just kind of wrap up with the timeline, and then we will continue this conversation. We'll do this again. Let's do this again in the very near future, and then we will put these online and string them together, and so we can get as many questions answered as possible. Clearly, there's a huge demand for answers here. So I just want to wrap up with the timeline, Kelly Jo. So between now and October 15th, we're kind of in this research phase, right? Everybody should be figuring out what they want. What happens on the 15th of October, and what are the timelines?
On the 15th of October, people can begin enrolling in plans for 2026. And that enrollment for most people goes through December 7th. What is unusual for the UCare enrollees is they have extra time to enroll in a plan. They don't have to do it by December 7th. But if they want the coverage to take effect January 1st, we strongly encourage them to enroll before the end of the month in December. So they've got some kind of coverage, including the prescription drug coverage. And then the coverage decision you make starting on the 15th through December 7th is what you will have as your plan in 2026.
Okay, so December 7th is really such an important date to remember for everybody. If you get it in by then, you will have that coverage starting on January 1. After that, no guarantee, right? It could start later. So December 7th, very, very important. Kelly Jo, thank you for your time today, and not to put you on the spot, but we want to kind of keep doing exactly this, probably even almost weekly between now and when we get over this hump. So thanks for your time, appreciate it. Thanks to everybody.
Well, thank you so much, and those two people that stumped me, get that information in so I can learn something too.
Yeah,
thank you.
Yes, thank you. We'll talk soon. All right, Kelly Jo Greiner, Medicare Product Manager at the state of Minnesota. We're